How did Flynn get measles?
From his sister. Hi, I'm Dr. Robbie. Georgia is fine. She's in our staff room. She's the one who actually called 911 and probably saved her brother's life.
Georgia was sick, but she got better on her own quickly.
Yeah, many people get better on their own, like Georgia. However, as many as 1 in 20 kids that get measles get pneumonia, like your son.
Are your children vaccinated against measles?
No.
The MMR vaccine is perfectly safe. Measles is not.
Peds Patrol here, and I've been getting this video shared to me a lot. So let's actually talk about the dynamics of what's happening in this clip and about measles. So this is a very tense environment. This is something that we actually see on a day-to-day basis, especially nowadays with vaccine hesitancy and some mistrust in the medical system and the healthcare system in general. So let's outline the positives. It's very good that the parents are being informed and reading about things like medical conditions online and on the internet. It's also very good that the parents are asking about their son's medical treatment, some of the decision making that is happening in the room, and some of the alternative medical options that are out there. I think the challenge and the frustrating thing that the doctors are experiencing is that there's clearly a disconnect in terms of miscommunication or misunderstanding about what is the best standard of care treatment for these conditions, especially when there's proven effective therapy that can be done from the get-go from a primary prevention perspective. And now, since the child is unwell, there are things that need to be done to help reduce the risk and the severity of measles infection. You can check out my previous videos where I talk about the complications of measles and why it's so important to get immunized when you can. I think a lot of healthcare providers get frustrated when there is this sort of a la carte option for medical management. So in this case, not getting the vaccines and not doing the spinal tap is okay with the family, but somehow getting intubated, coming to the hospital, and receiving medical care is okay. So I think for a lot of healthcare providers, this dichotomy where you can pick and choose what you want in the healthcare system seems a little bit inconsistent. One can argue that intubating somebody also has a lot of harm in it as well. It can cause vocal swelling, it can cause air leak, it can also affect the dentition of a child, and sometimes it can even cause lung collapse. Yet for this family, intubation is okay, but not getting a spinal tap to rule out brain infection is not okay. And also, given that the child is unwell, we don't necessarily have the consent or the assent of a child in terms of what they would like for their medical management. Perhaps in a less critical situation, there can be a conversation with the family and the doctors to come up with a combined plan in terms of what is best, effective, and safe medical practice. In those environments, questions and concerns can be addressed, as well as follow-up can be addressed as well, which is very important to have regular scheduled visits with your family doctor or your pediatrician to answer those questions in the event that a critical illness does happen later on in your child's life.